It's your girl Honey Da Vinci, and I'm back with another video. So the other day, Will and Jada hosted another segment of Red Table Talk, and they had their family there only, and they were speaking in regards to the COVID-19 coronavirus that's going around, and they spoke in regards to, the epidemic that's going around, and laid some of our worries to rest and just gave as much education and information as possible on this episode. They did have an expert there via satellite named Micheal Osterholm, and he is an epidemiologist, and he's basically was there to put the rumors to rest and stick with the facts. Because as you all know, I'm sure you've seen it as well. I know I have. I've seen a lot of debates going on social media. People saying that we need to do this, like wear masks. People saying that the masks don't work. People saying that we need to wash hands. People saying that we need to wear gloves. People saying all these different things. And basically, Will and Jada said, enough of the rumors. Let's get an expert in here so that we can educate our community. And I really appreciate them for doing that. So Dr. Osterholm, he is an epidemiologist, and he is the world's leading expert on viruses and pandemics. And yes, I do have notes because I want to give you as much accuracy in my video as possible. I don't want to mix up any words. I don't want to make any mistakes. I want to give you as much facts as possible because it's very, very crucial to our community, okay? And these are coming straight from the expert, okay? So, Will talks about how he feels kind of a responsibility to educate us because he feels like he's partially responsible for a lot of the misinformation going around, because he filmed I Am Legend, and people like to associate real life events with movies. And even though I don't feel like Will should have to carry the burden of the misinformation of going on in the community, I do appreciate him taking the responsibility and saying, hey, you know what? I see a lot of people referencing this movie I did and equating it to reality. Let me use my platform and my wife's platform to educate you on the facts. And you just have to love Will and Jada. Like, they're incredible, and like they need to adopt me. But so he talks about how when he was doing I Am Legend, how he did travel to the CDC, and how there is a basic comprehension that a lot of people lack in regards to viruses and pathogens that he learned a lot about while going to the CDC. Now, one of the main questions is, how do people get the coronavirus? Now, this is something that I saw myself on social media. A lot of people were saying that the virus is airborne, and then a lot of people were saying that it's not airborne, that you only get it by touching things and you don't breathe it in. Well, the expert Micheal Osterholm did confirm that it is airborne. Now, it's not typically airborne like some viruses that travel at a large distance immediately, but it can linger in an airspace for hours and for a wide distance. So let's say, for example, you're in your living room and you have the virus, right? And you sneeze. And now, even if he said you don't even have to sneeze. You can literally, at some point, just be breathing, because the particles of the virus are so tiny that they're like how when there's things all over our bodies right now that we don't see, and because we don't see them, they're not a part of our consciousness, but they exist. You know what I mean? There's all types of bacteria and all types of different varieties of atoms and molecules in the air and just in life in general that we don't see, and because we don't see it, they aren't a part of our reality as far as our consciousness. Basically, that's how tiny the particles of this virus is. Like, we don't see them, so there can be the virus floating in a cloud at a grocery store. Like, let's say you go to Walmart because you need to stock up on some water or some tissue, apparently, because that's what everybody seems to be buying. And you go to Walmart and you don't know that there was some woman there 3 hours ago who had contracted the virus and sneezed in the store 3 hours ago. And you're coming through the store and just walk through a cloud of the virus. Now you're infected. So it is airborne. And he also let us know that most of the contraction is via breathing. So not only is it airborne, most of the people who are getting sick from breathing. They're not getting sick as often as touching things and then touching your face. Even though you can get sick by doing that, that isn't the main way people are getting. The main way people are contracting the virus is by breathing it in. Okay? Do you understand that? And another way that it is airborne is, let's say he referenced a situation where there was a cruise, and on the cruise someone had the virus, and the ventilation system, it seeped into the other rooms of the cabins through the ventilation system, and next thing you know, everyone on the cruise had contracted the virus. So these are examples of how a virus that may not be as airborne as to just like get into the wind and then just travel all over the place like a plague. It isn't that airborne, but it's definitely airborne. Like if I sneeze in my living room and I happen to have the virus, it can go in the vents, get upstairs, and get everyone in the house sick. You know what I mean? So that's what he was talking about. And it lingers. So you can sneeze and it can linger in the air for hours. It can linger in the air for hours. And you can just breathe that in, and you don't have to sneeze to transfer it. You can literally just be breathing, and you breathe in and breathe out the virus. You get what I'm saying? So it's that serious. And what he was saying about the mask is some masks do work and some masks don't work. Now, a lot of people are going out and buying surgical masks. He broke down that the surgical masks are not the masks that work. Surgical masks are not to protect the doctor from the patient. Surgical masks are to protect the patient from the doctor. So a lot of times when doctors are doing surgery, they're hovering over an open wound on, a patient. Like if you're cutting open someone's chest for breast surgery, like if they have breast cancer, or if you're cutting over some surgery to close a wound or open up and take out a tumor or whatever, they're over all of this very delicate flesh that can get infected. So they don't want anyone sweat or slob, or maybe the doctor has, who knows what the doctor might just have on his face or something. It's to protect the actual patient. So getting the doctor's mask isn't going to help, because the molecules, again, of the virus are so tiny that while you have your mask on, the sides are just open, and the tiny molecules will just follow the air of your breathing. You're breathing in and you're sucking out like a vacuum, you know what I mean? So the air can just literally just pull it right on in into your mask through the sides. So those don't work. But the mask that he says does work are N95 respirator masks. Those work because he said it's a very tight mask. You know what I mean? So it's very a tight fit, and it has like a piece of paper or whatever, something that's similar to a piece of paper that absorbs anything that comes through. And he said those type of masks are the ones that he would recommend, and those are the ones that the doctors who are actually in contact with the patients who have COVID-19, those are the masks that they are actually wearing. They're not wearing the typical surgical mask. They're wearing the N95 respirator mask, okay? Now, Willow asked the doctor, because Willow was, like a lot of us, very panicky, and she has a lot of anxiety in regards to this virus. So she asked the doctor, like, what's the difference between the flu and COVID-19? Because, with a pandemic, can't a flu be sort of like a pandemic virus? And the doctor confirmed that yes, the flu can be like a pandemic virus, and they have in the past. You know what I mean? So there is a lot of similarities to the COVID-19 and the flu. So she put that, he answered her question when it came to that. And another question that he answered is, why is the government taking such extreme measures with the COVID-19 specifically if it is just a regular virus? Now, the answer to this question was very good, and I appreciated this answer because it really opened my mind a bit too. They said that the reason that the government and everyone is taking such extreme measures to, combat this virus is because the virus is going to spread regardless. There's no stopping it. It's a new virus. That's what makes it a pandemic. It's a new virus and they don't have any treatment for it yet. So it's going to go through the course of humanity. But what they're trying to do is stop the over interaction with it. They're trying to slow down the interaction with it. So let's say, we'll break it down like this pretty much. Let's say a hospital, because when you get when you get the COVID-19, you get respiratory issues. You know what I mean? Your chest shut down. You get symptoms like pneumonia and things like that, right? So let's say a hospital has 40 beds that can accommodate 40 people with respiratory issues specifically, right? Now this virus comes and 50 people catch the virus and, they all rush to the hospital, right? Now 10 people with severe complications are not going to be able to get treated because there's not enough beds to accommodate those 10 people. There's only 40 beds, but 50 people are arriving to the hospital. So to avoid situations like that and the mortality rate skyrocketing, they're trying to promote social distancing to help people to slow down the process of the virus. Because like they said, eventually everyone is going to come in contact with the virus. But what they would prefer is, instead of 50 people coming to a hospital with only 40 beds, they would rather 20 people come to the hospital with 40 beds, because then everyone will be able to get treated and less people will die because of it. You understand that? So instead of waking up one day and boom, 20 people have the virus, they would rather, boom, you wake up, 5 people have the virus. You get that? Do you understand that correlation? They're just trying to slow down the process because the virus is coming inevitably. So by social distancing, you slow down the spread of the virus and you give doctors a chance of being more equipped to help the people who are in critical condition. Okay? Now, if everyone keeps thinking, oh, this virus is nothing, ain't nothing to it, oh, it only affects old people, more people are going to get sick at the same time, and then they're all going to rush to the hospital, and there's not going to be enough treatment for everyone, and then the mortality rate is going to rise because not everyone's going to be able to be treated, which makes perfect sense to me. That makes perfect sense. And the expert, Dr. Micheal Osterholm, he broke down that in this day and age, hospitals don't keep as much extra supplies as they used to. Like back in the day, they used to keep an overflow of supplies in case situations like this happen, but they've stopped doing that. They don't have the resources. So if the hospital structure was to break down, it would be overwhelming to humanity and this virus would just get out of control. So that's the whole point of social distancing. That is literally the entire point of the stores shutting down, and for any type of businesses that can compromise the well-being of people being interactive with other people for no reason. That's why they're all getting shut down. It's not because the government just wants to, be mean and do this stuff. No. No one wants to lose money just for fun. None of these big corporations are just taking a break on getting money. That's not reality. The reality is they're trying to slow down the spread of the virus. Yes, to some people, they might get the virus and they might not have serious symptoms. Whoop-de-doo, you're not the only people on the planet. There are a lot of people with health issues. And there's a lot of people who, and that's what I liked about this episode too. They brought on a 25-year-old girl who had the virus. And she was obviously via satellite. She wasn't actually there. She was via satellite as well. And she talked about how she caught the virus and how she's been sick for 11 days in quarantine. And she talked about how her friend flew in from London. And when he was there, he seemed like he had a little bit of a bug, but nobody thought anything big of it. And by the third day, her and 5 of her other friends had contracted the virus. Now, when they first started showing symptoms that they all were sick, they were joking around about how they had caught the virus. Like, oh yeah, oh yeah, I look like I got the virus, blah, 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 blah. Then, next thing you know, boom, shit started getting real. People started getting really sick, and it wasn't going away. So they all went and got tested, and boom, they all had the virus. Now, her specifically, she has serious respiratory issues. Like, she had mono before, and she had like some type of other disease that she had, and so obviously the virus was affecting her on a next level than her friends. But her friends were sick for a few days, and she's been sick for 11 days because she has the respiratory issues. But she's only 25 years old. You understand that? She's not 40, she's not 50, she's not 60, she's 25 years old. And she spoke about how one of her other friends is 30 years old and is in full health, but is in critical condition in a hospital currently because of the virus. So it's not a game, it's not nothing to play with. And honestly, I feel like people should just relax and take this social distancing serious, take it in accordance, and stop just thinking about yourselves. Just because you feel like you're in good health and you'll be able to pass the virus if it comes, and you feel like you're good, doesn't mean the person next to you will be good. And you don't have any way of knowing 100% sure that you will be good. So to avoid the people you love getting sick, take the precautionary measures. And I feel like it was great that Will and them had this guy on the show who was an expert and could break it down. What else did they talk about? They talked about a lot of things, so let me look at my notes. Alright, so the symptoms of the coronavirus is dry cough, fever, and body aches. So those are the basic symptoms of it, but the girl who had the coronavirus, she talked about some other symptoms as well. She talked about losing her sense of taste. She talked about her chest feeling like she couldn't breathe, and that's a part of the respiratory like feeling that you get. She talked about feeling like once her, I think she said her 5th day, she started feeling like she couldn't breathe and like her chest was clogging up. She also talked about how hard it was to get tested. Hold on, I'm going to take a sip of my drink. Listen. Another thing that they said is the disease affects older people and people who smoke and who have smoked in the past. Now, go ahead and be scared, y'all. Because I know a lot of y'all who done been smoking them Newports, smoking them Black and Milds. Come on now. So, a lot of people with those type of issues are really suffering because, you know, it's your lungs have taken damage over time. And when the COPD does, you know, contact your body, it affects your lungs. So, yeah. Be careful, y'all. For real. It's out here. Now, they ask, what's the difference between this virus and other virus? Like, if it's just like a basic virus, why are they taking an extreme measures to, you know, go off about this virus? Now, I already told you about the hospital structures and not wanting to overwhelm those. But another reason is they use, for example, AIDS and HIV. So when AIDS and, well, let's say when HIV first came out, right? It didn't hit so hard right away. You know what I mean? It took years of time to spread. So it was, you know, able to maintain and get people some sort of help, and it didn't overwhelm the hospital structures. You get what I'm saying? So it wasn't a situation where you went to sleep and woke up and boom, 20 people you know have HIV. It wasn't like that. It was like you might have known one person your entire life that had it. And even to this day, you might have known one or two people your entire life that had it. You might see people on TV, but you don't know them personally. In your personal life, you might know one or two people who had it. With the COVID-19, you can literally go to sleep at night in a neighborhood that has 0 cases of the virus and wake up the next day and boom, it's 20 people with 20 cases of the virus. So being that it's spreading so fast, that's why it's more serious than most regular viruses that have come in contact with the community. Now, as far as young people, it's still serious for young people too. So basically what the expert was saying is young people can have the virus, and being that we don't get affected by it as much as older people do, we can have it and not know we have it and not have any symptoms. Do you understand how dangerous that is? You can be walking around with the virus and have no symptoms. And because you think you don't have it, you can be around people who have bad immune systems and infect them, and they can die because of you. So just because you aren't influenced by it where you're in critical condition in the hospital, you can kill someone else with your lack of education and lack of knowledge on where you stand with this virus. So you walking around thinking everything's cool because you're young and you can't get sick off of it like older people, and then you go visit your grandmother thinking you don't have it. Now you done infected your grandmother, and your grandma's in critical condition in the hospital on her last breath. So it's very important for everyone as a community to come together, take it serious, stop playing around, and just stay your ass in the house. Okay? Stop trying to find reasons to be outside. If you run out of supplies, that's one thing. Take your ass to the store, get what you need, come home in the house. But don't be out just doing shit. Okay? Don't just be out doing shit. Stay in the house. Relax. Kick your feet up a little bit. Interact with your family. Get off your phone. Interact with your family a little bit. Okay? Do stuff like that. It's going to be okay. But if y'all keep playing around, it's only going to get worse. Okay? Y'all keep playing around. And they said that. They said everyone is going to come in contact with this virus at one point or another. You have to control how you come in contact with that virus. The only thing you can do is control how you come in contact with that virus. Now, you can either come in contact with it because you're playing around and you're still around everybody and you're still out doing whatever you want to do and you're still taking it lightly. You can come in contact with it that way and infect a whole bunch of people and make things worse for people that's already in the hospital trying to get help. Or you can just chill, you know, do social distancing and wait for this shit to pass and to, you know, come and go. One or the other. But I know y'all gonna get tired and this shit gonna catch up to everybody eventually. So you can either let this virus stick around longer than it has to and, you know, let these, you know how they waiving everybody's rent and all this shit. You can let that pile up. You can let your jobs be shut down for longer than they need to be and let these bills catch up on your ass. So when this shit is over, now you're under the water drowning with bills. Because you know that's going to happen. They're not letting us get off with all this waiving bills and shit. You're going to have to pay the shit back. So you can either play around, let the shit last, instead of 3 months, let the shit last 2 years. Then in 2 years, your ass be thousands and thousands of dollars in debt. Or you can just do social distancing, be a responsible adult, stop playing around all the time, and stay your ass in the house and out the way. And video chat people you want to see. One or the other. Because one or the other is going to happen. Okay? A lot of people I see online is like taking it lightly. Like, oh, this isn't real. This isn't real. Do you really think these mass corporations that are funneling in millions of dollars are going to stop their money flow to play around with us? Like, use your brain. They literally shut down the NBA. That is a billion-dollar corporation. They are losing millions every single day by shutting it down. You think they're doing that for fun? You think they're just playing around with that? You think that's just like some, oh, they just trying to get a rise out of us? No, stupid. When have you ever known in history, right, for these mass corporations to voluntarily stop their own bag? When have you ever known that in the history of your life? When? Voluntarily. We're just all going to just stop our own bags. When has that ever happened? So what makes you think this is a joke? It's not a joke. And it ain't going to be a joke when it hits someone you love. Because then it ain't going to matter that it skipped you. When you burying somebody you love. So I just feel like everybody should just take it serious. Try to make this shit as short as possible so we can get back to living our lives normally. And that just be that. You know, and just let this just be a moment in history that we all look back on and talk about later. But if y'all keep playing around, you're going to make it more serious than it is. And an expert said that. He's saying people keep comparing it to the regular flu, like the influenza. People keep comparing it like, well, yeah, the flu is worse than that. He said by the time people start taking it serious, it's going to be worse than the flu. Once these hospital structures have crumbled and people stop being able to get treatment because there's too many people at the hospital for the hospital to accommodate, and people start dying at larger rates, then y'all going to wake up. But it's going to be too late. Okay? So wake up now. Wake up. Wake up. Clap on. Do I got to snap? Is that waking you up? Like, cut it out. Get it together. And, you know, before I go, I just want to talk about how wonderful Will and Jada are because I love them, and I just can't make a video about them without talking about how much I love them. If you guys ever watch this video, I just want y'all to know I love y'all, and I see what you guys do for the community, and I appreciate y'all's knowledge and education and dedication to educating the community about not even just this virus, but just mental health and love, and you know, just the essence of humanity. Like, you guys just exude positivity, and you're just wonderful people, and I love you guys. And if no one else told you that, I'm telling you guys that keep doing what you're doing. You're doing a phenomenal job, and you are appreciated. But that's my video on Red Table Talk with Will, Jada, and the family, and this coronavirus. You guys stay safe, stay quarantined, and stay in good spirits, okay? This too shall pass. Love you guys, and I'll catch you in the next video.